In orthopedics, we have very specific examination points for the patients that we're seeing. In my own practice in sports medicine, I see a lot of shoulders and knees. We found with looking at other systems, and even in this system, that some of the data points apply, some don't. And so the ability of this system to let us go in and tailor it to our own needs has been very important. It just seems as though we are much more efficient. Our documentation, I can go back a few years before we started this process and look at my notes, and based on the time restraints that we have in our practice, my notes were not nearly as thorough as they are right now. So I feel much better about my coding abilities to be comparable to the amount of work that I put into the note.
Several of the doctors are using point-and-click templates which fill in the note. I myself and a couple of the other doctors actually have formed favorites where we have bullet points and then we use drag and speak to fill in the drag and points and make it more of a customized type of dictation.
I've tried to keep office notes more on a personal level, very unique to the patient. So we have integrated the product with voice-activated software. So we use the templates for some of the more mundane portions of the examination and for the past medical history. But we have gone in and through the voice recognition technology, we've been able to tailor our history of present illness to the patient specifically.
I don't use the template area a lot, but I use the favorite area, and that's very easy to customize to orthopedics because I can go in, pick the exams I want, pick how the exams are formatted on my dictation, and I can make bullet points so that that can be consistent every time I see a knee patient or I see a hip patient. I have the same exam and it'll be in my favorites, which I can go to, just click that on the encounter and it populates that for me.
And also when we get into the examination, we have found that when we're describing things, we like to describe it in our own terminology, and so we've used the voice recognition, forming various templates for various problems that we see over and over.
All I have to do is click a certain tab. I have access to their medication records, their history, any tests that have been scanned in. We even have the ability to scan in images, arthroscopy photographs and so forth that I can access immediately right from my desktop.
Certainly we've been able to generate our notes at a much rapid and more efficient manner. A typical day for me involves a half-a-day clinic, half-a-day surgery. In my half-a-day clinic, I normally see between 20 and 30 patients. In the past, I would end the day with a stack of charts and would have to dictate either later that day or the next day. And since we started the EHR, when I finish clinic, I'm done with my notes.
Originally, we dictated into dictaphones. The dictation person took that. It could be gone for anywhere from a day to 3 days, depending on the backlog. And then that transcription was finalized in the patient chart up to a week afterwards. Now with Intergy EHR and Dragon, we dictate right away, right after we see the patient, and pretty much the dictation is finalized almost before the patient leaves the office.
The preferring providers love it because we're able to complete our notes at the time of visit, and the system is set up where we just immediately send that off electronically to the primary care doctors, so there's no lag of 3 to 5 days.
With the records being available pretty much by the end of the day, our medical records person has the ability, especially through EHR now, to fax directly to that doctor's office. And so theoretically, we could see a patient on Monday and the primary care physician can know by Tuesday exactly what we're doing, what tests are being planned, and have our full office note right in front of them. I think our patients really appreciate the fact that we are up to date with our technology, and yet we are using that technology efficiently outside of the room. We aren't bringing a computer or a tablet into the room, which could be a barrier between us and the patient, and they appreciate that we still have one-on-one contact and yet have the efficiency with the electronic documentation to give them what they need efficiently.
The patients love it because a lot of them come in needing various things for liens as far as automobile accidents. Their attorneys need notes. We have workman's comp patients who come in that they want the information as soon as possible. And in most cases, we're able to generate it on site, and we were never able to do that in the past.
It lends itself very easily to the workflow in a patient day. And again, my biggest thing with it now, especially being a PA taking calls. It's very efficient on the weekends and at night.
We're able to access it from home. So all of our documentations that occurred at the time of surgery are then scanned into the electronic health record. So as I go through my daily routine, I'm able to access all of the information in the electronic health record from my phone, which has been a tremendous help in being able to handle patients' calls when I'm not on site at the office. We found that we're able to put together an examination that is very consistent with what we're trying to represent in the record.
Overall, it's just been a huge time saver for me.
When we open up the chart, all of that information is there, and really it allows the doctor to be a doctor.